Suppose walking into a doctor's office, carrying not only your aches and pains, but also the weight of your years, your stories, and your dignity, expecting to be seen as a complete human being, full of history and value, only to discover that behind the polite smile and professional tone, there are unspoken thoughts, hidden biases, and quiet judgments that you may never hear out loud, but that shape the way your care unfolds. Today, I want to take you on a journey into those hidden corners, to reveal what many doctors really think of older people, not because all doctors are unkind or careless, but because they are human, shaped by pressures, fears, and systems that often reduce the elderly to problems instead of people. And as difficult as these truths are, they must be faced, because only when we know them can we protect ourselves and demand the respect and dignity every senior deserves. The first ugly truth is this: many doctors quietly see seniors as complicated cases. To them, an elderly patient is rarely a simple diagnosis or a quick prescription, but rather a tangled web of medical histories, multiple medications, and symptoms that overlap and blur together, making the process of treating them slower, harder, and sometimes frustrating. And while you, as a senior, may walk in hoping to be heard fully, the doctor may already be feeling the pressure of time, the weight of paperwork, and the knowledge that your case will take longer than the 15 minutes the system allows. Some even sigh internally, bracing themselves for a challenge. And in that silent moment, empathy is sometimes replaced by impatience. And instead of seeing your strength and resilience, they see obstacles and complexity, leading to rushed visits, overlooked details, and sometimes misdiagnoses. And the sad part is, you don't even know that this invisible wall has gone up. You just sense that you weren't really listened to, that your pain wasn't fully believed, that your story wasn't fully valued. The second truth is equally unsettling. Many doctors underestimate seniors' intelligence, whether consciously or unconsciously. They assume that older people don't fully understand medical jargon, that they can't process complex treatment plans, or that they shouldn't be burdened with details. So they simplify explanations, gloss over options, or even talk down as though explaining to a child. Some may avoid advanced treatment discussions altogether, assuming you wouldn't want them, or that you wouldn't understand them, and this quiet underestimation leaves many seniors feeling small, dismissed, or left out of the very decisions that affect their lives. It's not uncommon to see a doctor addressing the adult child in the room, instead of the senior sitting right there, speaking as if the elder is invisible. And yet what so many doctors fail to recognize is that behind the wrinkles and gray hair is a mind sharpened by decades of experience, capable of wisdom, capable of choice, capable of engaging fully in complex conversations. But when a doctor assumes otherwise, it creates a power imbalance that strips seniors of agency and dignity, leaving them with lingering frustration and the silent thought, why won't they talk to me directly? Don't they know I can understand? The third ugly truth is one most doctors will never admit aloud. Many of them privately fear aging themselves. They may spend their days treating conditions of the elderly, arthritis, dementia, frailty, heart disease, but in the quiet corners of their own minds, every patient becomes a mirror of what awaits them. They see in your wrinkles the lines of their own future. They see in your slowed steps the fragility that will one day be theirs. They see in your memory lapses the shadows of decline that they too cannot escape. And instead of responding with empathy, some create distance, a psychological barrier, to protect themselves from that uncomfortable reality, and in doing so, they sometimes lose the ability to see you as an individual full of dignity and worth, instead reducing you to a symbol of something they fear. You become not just a patient, but a reminder of mortality, of loss, of the inevitable passage of time, and that unspoken fear often makes them cold, clinical, detached, more concerned with tests and charts than with human connection, because deep down, connection reminds them too much of their own vulnerability. The fourth ugly truth is even harsher. Some doctors secretly believe treatment isn't worth it for seniors. They weigh the risks of surgery, the costs of medication, and the years of life that remain. And in quiet calculations, whether spoken aloud or kept within, They sometimes decide that investing deeply in your care is not the best use of resources. This is where ageism meets the economics of healthcare, where seniors are seen not as individuals with priceless value, but as numbers in a cost-benefit equation. A younger patient may be offered aggressive treatment, while an older patient may be told, "Let's keep you comfortable." Not always because it's best for the patient, but because the doctor has silently decided that the potential return on investment is lower. This bias means many seniors never even hear about the full range of treatments available because the options are withheld before they can choose for themselves, leaving them with less care, fewer chances, and a hidden injustice that strips them of the opportunity to fight for more time, more health, and more life. And then comes the fifth and final ugly truth, perhaps the most painful of all. Many doctors see seniors as near the end, and therefore not worth deep effort. Instead of investigating symptoms fully, they attribute them to just aging, brushing aside pain, fatigue, or cognitive decline as inevitable rather than treatable. Instead of saying, "Let's figure this out," they say, "That's normal for your age." And in that moment, they make seniors feel invisible, as if life beyond 70 or 80 doesn't deserve the same attention and care as life at 40. This quiet dismissal robs older patients of dignity, of hope, and of the rightful expectation that every stage of life deserves full medical effort, because aging should not mean neglect, and yet for too many doctors it does. And the result is seniors leaving appointments unheard, untreated, and unseen, carrying the silent weight of being considered already done in the eyes of the very people entrusted with their health. These 5 ugly truths, being seen as complicated, being underestimated, being reminders of mortality, being judged not worth the cost, and being dismissed as at the end, are painful to acknowledge. But awareness is power. When you understand these hidden attitudes, you can push back, you can ask questions, you can demand answers, and you can remind your doctor that you are not just a diagnosis, not just a number, not just an age. You are a full human being, rich with history, wisdom, and dignity, deserving of time, respect, and the best possible care. You have earned the right to be treated as more than a case file, more than a burden, more than a statistic. You have earned the right to be seen, heard, and valued, no matter your age. So if you are an older adult listening to this, or if you love someone who is, remember this. Do not accept being brushed aside. Do not accept being underestimated. Do not accept silence where there should be answers, because your life matters. Your health matters. Your voice matters. You are not at the end. You are in a chapter that still deserves to be lived fully. And every doctor, every nurse, every caregiver should remember that. Age should not silence you. It should amplify you. Because in your years, in your wisdom, in your resilience, lies a truth greater than any medical chart. The truth that every life, at every stage, is worth the deepest respect and care.